Okay, it looks like we are ready to go. So I believe we are going to go ahead and have Patrick share his screen. So thank you for joining us. We are excited about tonight's presentation. This is kind of a second part from last month's Wednesday Wellness for Women when we discussed anxiety and depression for women. Now we are focusing on our pediatric demographics and parents of children ages 5 to 18 is our target audience here. Of course, all parents can benefit from this information. We are going to be discussing parenting through anxiety and depression, and we are going to start off with our pediatrician and physician champion for behavioral health, Dr. Kerri Randall. So, Dr. Randall, I will let you take over.
Hello, everyone. Sorry, it was me having technical difficulties. My daughter had logged into my Zoom account under her email, which is what the issue was. But we've got it all figured out now. So I'm excited to join everyone tonight to talk about behavioral health in pediatrics and to help us recognize children with anxiety and depression. Because it's a very real issue going on in our world right now. So I'm excited to share with you. That's my picture on the left. I'm a pediatrician at Cherry Hill Village in Canton. I joined that practice 13 years ago, right out of residency, and have been there ever since. I'm excited also to introduce you to Leah, Diebel, and Patrick Gaulier. They are part of our pediatric behavioral health team. They joined our offices within the past year, which has been so timely. They're providing excellent care and help to our pediatric patients during this difficult time. So I'm excited to introduce them and let them share some of their expertise with a wider range tonight, a broader audience. So moving on, topics that we'll kind of touch on tonight: facts about anxiety and depression in children, ways to help you recognize those symptoms in your children, mental health changes during the global pandemic, screening tools that we use for anxiety and depression, prevention and treatment of anxiety and depression, the importance of diet, exercise, sleep, and a good support system for your children, and then touching a little bit on therapy and medication options. So why this topic? Why now? You can see my COVID viruses masked up appropriately there on either side of the slide. So this is just so timely. You know, the past year has been really challenging for everybody. We've been through hopefully a once in a lifetime pandemic, and it seems like we're on the uphill climb here, coming out on the other side. But you know, things that we've weathered over the past year: virtual school, hybrid school, in-person school, deciding what school's right for you, quarantining, can we get together with friends, have we been exposed? You know, we've also dealt with increased screen time for our kids, decreased physical activity opportunities, pauses in extracurricular activities, and social isolation. You know, and those things on the right side there have been our kids' stress relief and stress outlets. And so we've kind of put them in a very stressful time and then taken away everything that they use to cope with that stress. So it's bringing anxiety and depression more to the forefront in our population. And I didn't even mention working from home, multitasking, you know, trying to be on a meeting for work and help your first grader with her reading and manage a household on top of that. So lots of reasons why this issue is a great one tonight. So basically because of 2020, that's why we're talking about this tonight. This is just one study to kind of highlight the information that I think everyone is probably intuitively aware of. You know, this meta-analysis looked at 15 studies talking about the effects of COVID-19 on the mental health of almost 23,000 children and adolescents. And when they looked through these studies, they found that the behavioral state of almost 80% of children was negatively affected by the pandemic and quarantining. Parents reported that almost 35% of their kids had increased anxiety, 42% had increased depression, and then they also noted irritability, inattention, boredom, sleep disturbances, and that almost 25% of kids had reported themselves a significant fear of COVID. And it wasn't just kids alone that are affected by this. You know, caregivers are also reporting in themselves that while being in isolation with their children, 52% have increased anxiety and 27% have increased depression. So these numbers are certainly something that I think is translating into our everyday life. I myself in my own pediatric practice have definitely noted an increase in kids coming in with mental health concerns that can be directly related to this pandemic. So I have a few real life examples for you. The first one is a 12-year-old boy with fatigue. He seems tired all of the time. He spends all day in his bedroom. He's very irritable with his family members, especially his siblings. He often complains of headaches. And then I have a 10-year-old little girl with chest pain. She states that it usually happens before bedtime. Her breathing feels funny, like she just can't get a good breath of air. Her stomach hurts a little bit and she might throw up. She feels like her heart is beating fast. This improves with deep breaths. Now this 8-year-old little boy has some behavior issues. He's not getting his schoolwork done. He doesn't seem like he listens to anything. He has conflicts with his siblings. He's very sensitive to corrections. His parents sometimes wonder, gosh, does he have ADHD? And then finally, the 6-year-old with a sleep concern, she's having trouble falling asleep at night. She's waking up and coming into her parents' room in the middle of the night. She's an early riser, and then she's irritable during the day because she's not getting enough sleep. Now, these 4 examples sound like patients that I would see in my office, and I certainly have seen patients like this in my office. But the interesting thing here is these aren't my patients at all. These are my kids. I have 4 kids, 2 sons and 2 daughters, who all through the course of this pandemic have showed me signs that they're struggling with their mental health. And as you can see, not one of these kids came to me and said, Mommy, I'm worried, or I'm stressed, or I had a bad day, or I'm feeling sad. They showed me with physical symptoms or with behavior changes. And, if I wasn't a general pediatrician, I definitely would have had these kids into my doctor's office, asking them, what is wrong with my child? What is causing this chest pain? Why is my son so tired all the time? Why isn't my daughter sleeping? Why is my 8-year-old acting like he has ADHD? I recognized it for what it was and was able to identify it. And that is one of the reasons we're having this discussion tonight, is so that I can help you recognize these symptoms in your kids to help them get the help that they need. So as we were saying, not every child, most children, in fact, don't come to you and say, gosh, I'm feeling really worried, or I'm really stressed, or I'm not doing well, I'm getting overwhelmed. They show it with physical symptoms. Things like stomach aches, nausea, headaches, bedwetting, tension in their muscles, or just aches and pains, heart palpitations, difficulty breathing, rashes, sleep disturbances, a tight feeling in the chest. Usually these symptoms are kind of vague. They're general, they're random. There's not a clear association with something that's causing anxiety. And they very well could be from physical causes, but oftentimes it's the emotional issue that's causing these physical symptoms. And again, they're not saying they're stressed or they're anxious, but they might show you with their behaviors. Things like avoiding certain situations, difficulty separating from their parents, anger, irritability, and tantrums, difficulties with transitions, refusing to go to school. That's definitely a very real one, especially after experiencing a period of time at home with your parents during a scary time. Unwillingness to try new things, social withdrawal, restlessness, trouble concentrating, feeling overwhelmed with everything they need to get done, looking for reassurance often from their parents or their other trusted caregivers, or repetitive behaviors, thoughts, or questions. And the same can be said with depression. Again, physical signs and symptoms of depression, many of those overlap with the symptoms that you would see with anxiety, but it can be for a very different reason. Things like sleep disorders, laying in bed, being unable to fall asleep at night, waking up frequently during the night, or wanting to sleep all day, tiredness or fatigue, seeming like we just don't have enough energy to get up off the couch, wanting to sleep all day long again, or just just not interested in doing anything that they normally like to do. Reduced appetite or weight loss can be a sign of depression. It can also be a sign of anxiety. Or the opposite, increased appetite and weight gain. And then physical changes in the way they move, moving so slow that somebody would notice, or the opposite, being so jittery and unable to sit still. Again, that fatigue or lack of energy, and we have to throw in, of course, stomach aches, headaches, nausea, substance abuse to self-medicate, or poor school performance. And again, those behavioral signs of depression, fatigue, loss of energy, feeling worthless or guilty, feeling like you're letting your family members down, losing enjoyment in things that you previously enjoyed doing, difficulty concentrating, thinking, or making decisions, wanting to isolate and be alone all of the time, or of course, having thoughts of suicide or death. And so again, it's just important to summarize that with all of these things, the kids are not coming to us saying, I'm depressed, or I'm anxious, or I'm worried. They are showing us with symptoms. And so, if your child is showing you some of these symptoms, it's probably a good idea to make an appointment with your pediatrician to take them in. We can look at all of the physical causes and rule all of those out, but don't be surprised if we also say, gosh, how's your mental health right now? How are you handling things? How are you managing all the changes in the world over the past year? And I have some other people that can help you. I think I'm going to pass it off to Patrick now. He's going to talk to us a little bit about why your kids are experiencing these physical symptoms and how to identify it even further. And then we'll go into what you can do for them at home.
Thank you, Kerri. Yes, my name is Patrick Gaulier. I work with IHA out of both the Arbor Park office in Ypsilanti and the West Arbor office off of Jackson Road in Ann Arbor. And I've been with IHA since about November. Prior to that, I worked at Ozone House for approximately 10 years, the Youth Crisis Center in Ypsilanti and Ann Arbor. And I'll apologize ahead of time. I have two very tiny dogs that are very adorable and very loud. And yes, I'll be talking about primarily assessment and mine and Leah's approach to assessment when we do get referrals from the physicians that your children are seeing, talking about some of the questions they would ask, some of the approaches that we would use, and some of the things that would indicate to us that there is a concern about anxiety or depression that could merit services from us. So very often when we are talking with families and we're talking with young people, we're talking about mind-body connections, that by addressing mental health issues, looking at education, situations like this where we're talking about identifying these signs and symptoms, talking about these signs and symptoms, resources, places to access the kinds of services that folks would need, advocacy, getting out the information and knowledge to families and young people about these kinds of services. And then action plans, ways of actually addressing the anxious and depressive concerns that do come up. We can work with families to better understand the mind-body connection that can lead to behavior changes and better overall health and quality of life. When families are able to recognize that the stomach aches, the headaches, the avoidance, the throat tightening are signs and symptoms of a mental health concern, then it's much easier. It becomes a much more straightforward thing to address than seeing a primary care physician and looking for a physical cause for these particular things. So we talk often about somatization, this idea that often the feelings and emotions and sensations we experience and how we interpret the world manifest physically within us. All of us know about this, that if we're anxious about something, we may get that roller coaster feeling in our stomachs. Our heart rate may go up. We may get a headache as a part of it. We recognize and know these things for things that bring us anxiety. For particularly younger children, that may not always be the case. And this is where often we are getting, Leah and I are getting referrals from primary care physicians that a parent will come in and note that they always complain about stomach aches. Through some testing and some questions, it's always a stomach ache just before school starts. That could be a sign symptom of anxiety. There's a young person that I started working with that always complained about her throat tightening. It was very difficult to swallow. And there was some testing and some looking into what physiological explanations could there be for this. And it came out to she had at one point swallowed hair and really did not like the sensation and became very anxious and nervous about swallowing things. And this can also come out through depressive symptoms that we know if we are feeling very down, we have that very low energy, with that very low motivation. We may have aches associated with it. Young children may not be able to identify that. And it's very difficult for them to, like Kerri was saying, tell them, oh, my mood is down. It's no, I have no energy and I don't want to do these things. These are some of the tools that Leah and I may access when we are talking with families and young people to assess for, is this something that could be an emotional explanation for what these physical symptoms are explaining, or, you know, if a parent is coming in very specifically for emotional concern, things that could indicate to us the severity of what it is we're talking about. And these are just a few examples of a lot of things that we could be accessing: a scared assessment for childhood fears and anxieties, GAD-7, the set of 7 questions to assess for and get a sense of where anxiousness is in somebody's life, the PHQ-2 or 9 for a similar thing, but for depressive sensations. CDI, also looking at signs and symptoms of depression. We may also, if we're talking about substance use, access a craft assessment. There are a lot of different tools out there that we could use as a beginning to and a start to our assessment process. And here are a couple examples of the kinds of things that would be on these the exact questions that we would ask, or that a family would have a sheet of paper that does ask them. We use this, talk with them about the low interest or pleasure in doing things, feeling down, depressed, or hopeless, as 2 of the major indicators if somebody is experiencing mood being very down, if depression is the thing that we are worried about with a young person. If we're talking about anxiety and there are worries about anxiousness leading up to school, to social settings, to seeing particular people in their lives, to going outside, I think, you know, Leah and I can talk. There are a lot of young people we work with now that the return to in-person learning has been very stressful, and there's a lot of anxiety related to that. I talk with a lot of young people that are very reluctant to engage in virtual settings because of their experiences with bullying. And so we talk about administering the GAD here to get a sense of how big that anxiety is within their life. It can be scored up to 21 for this particular adaptation of the GAD-7. And the higher the score, generally, the more likely it is that we are concerned about anxiety, and anxiety being a thing that describes this person's experience of the world. So, but that is just one component of what it is that we are bringing to this. And this is where Leah will talk later a little bit about some of the things we may ask of parents to help us in the assessment process, because your children are still learning, growing, understanding the world, understanding their interpretations of the world. So there are a lot of different pieces of information that we need to access to be able to have a full global assessment of what their experience is. So certainly the validated screening tools, scared assessment, PHQ, the GAD, the things that we've talked about. A diagnostic interview where Leah and I are sitting with a family for approximately an hour to get perspectives from parents about the kinds of things that are happening, to get perspectives from the young person about the kinds of things that they're experiencing. Generally, those initial assessments, you know, we all meet together with the parent and the young person ahead of time. Then we meet alone with the young person to ask them a separate set of questions. And then we have some questions for the parent to get a good picture of how things are at the family home, how things are with school, how they're functioning out in the world. The kinds of questions we may ask as a part of that is family histories of depression and anxiety. Can you tell us about that? Any previous treatment within the families? We would be asking about socialization. Talk to me about their friends. Talk to me about how they perform in school settings. Are they a shy person? Are they an extroverted person? Do they have activities and things that they do for fun and for joy? All these things are different questions that may lead us to a better understanding and a better explanation of what it is that their experience is. But often we are also reacting to the things and the answers that young people are giving us and digging deeper into where their concerns are and what their understanding of the world is. And then the behavioral observations, of course, is a part of that. And this is a big part where we lean on parents to be able to give us a lot of information, because, you know, if we're meeting with somebody every other week for an hour, we're only a 1 hour chunk of many hours. It's the parent that can observe, okay, are they avoiding certain things? Do they tell us that they're scared about certain things? Do they complain of stomach aches at certain times? Do they complain that they can't swallow at certain times? And that gives us a lot of information for, you know, how big the impact of that thing is on their world. So yes, we have the validated screening tools that can give us a good indication of if something is a concern we should be addressing. It's these 3 pieces that give us a very good understanding of how big this is in a person's life and how much it impacts them. So some things that I hear very often in our initial interviews, you know, he spends all of his time in his, and Kerri touched on this with her children examples before, he spends all of his time in his room, parents are worried, you know, he avoids us all the time, we have no idea what's going on, we're all just angry about this, she seems moody and angry at the time, all the time, there are little things that set somebody off, he never wants to spend time with us or his friends, he's always alone, always isolating, and they're so lazy all the time, not getting any chores done, any homework done. Leah will again talk more about this later, but we frequently reference the idea of behavior as a language of need. If somebody is moody and angry all the time, yes, that's frustrating as a parent. Yes, that's like we have to, in order to maintain a happy home, we need to be able to change this thing. But what does that tell us about their emotional state, and what does that tell you about what they need? And then we, at the sort of, as we continue our assessment process, and that may take several meetings to get a sense of, particularly for reluctant children and teens, what anxiety is in their life, what depression is in their life. We look at the degree to which a feeling, anxious feelings, depressive feelings, impact their daily functioning and life tasks. Anxiety is something that all of us experience. We all experience anxious feelings. They're all things that make us nervous, all things that make us worry. I think a lot of people are here because they're worried about their children. They're worried about people that they love in their life. All of us experience times that we are down, where our mood is affected, where things happen to us, there are losses that happen, there are painful things that happen. It is a part of life. The degree to which it impacts us is what tells us if treatment is required or necessary. If it's something that gets so deeply in the way that they cannot attend school, they cannot interact with their friends, then that's something that we talk about. Okay, is what Leah or I do appropriate for what they need? Then as part of that, we're looking at the frequency, duration, intensity of it. Is it, they're anxious every single day? They're anxious multiple times a day. Is it once a week? The duration, does it last all day long? Do they complain of stomach aches the entire day? If they are a teen, are they complaining that, that I do not want to go to school, or I am avoiding my friends every single day, several times a month, whatever the time periods are? And how big is it? Is it to the point where stomach aches leading to vomiting? Or is it that there's a little bit of a stomach ache, but they feel like they can handle it and they'll be okay afterwards? And then certainly we are always, particularly when we're talking about depressive symptoms, worrying about and thinking about, is this something that needs a higher level of intervention? And the thing that would tell us that is if there are worries about this person harming themselves. So if there are any thoughts of suicide, urges to harm oneself, or plans to do so, we'd be talking about emergency and crisis interventions, like the National Suicide Prevention Hotline, calling 911, seeing the hospital, anything like that. And then of course, if we have the positive screens and the tools that we mentioned before, treatment may also be appropriate, but would also require diagnostic interviews and time to talk with families and to us. And I believe at this point, I'm turning it over to Leah, incredible social worker, who will be talking to you about treatment and anxiety.
Hi, good evening, everybody. Thank you, Patrick and Kerri, for the wonderful information. So my name is Leah. I am also a behavioral health therapist at Cherry Hill Village in Canton. And I'm kind of going to be reviewing briefly the treatment overview, because there's a lot to go into that, but just to kind of highlight what modalities Patrick and myself utilize. At the end, if you have any specific questions, feel free to ask those. And then reviewing some emotional regulation skills, calming strategies, and then resources. Okay, so treatment overview. So we utilize cognitive behavioral therapy a lot with depression and anxiety. It is very kind of more on a brief intervention side, and I feel like it really reiterates challenging the thoughts that we're having and reframing them. Dialectical behavioral therapy really reviews mindfulness and building more of a distress tolerance to things versus kind of that challenge and reframe. We also meet with families, not just kiddos, and being in the pediatrician's office, it's nice because we have that access to assess potential need for initiation of medications. So, parenting support, emotional regulation, and coping skills. As we were, Patrick and Kerri were sharing wonderful examples of, can you hear me? Okay, good. So as Patrick and Kerri were sharing examples of Kerri's children, Patrick's kiddos that he sees here, that I see here, really having that real life example is helpful. And I saw a kiddo this morning, an example of not wanting to go to school. And with COVID, you are unable to get out of the car and actually walk your child in. And so there was difficulties with getting the child to move from the car to inside the school. And the mom was like, I don't know why they're doing this, and right? Why, and why won't they stop? And I think reiterating that behavior being the language of need, and really having that opening the door for the dialogue of what else is going on? What are you worried about? As we were talking about that change from in-person to online to in-person again to maybe you had an exposure so you're quarantined, has really created a heightened fear and worry about and what is going on around us. And I think that gives us really that great segue into taking a deeper look on what is going on and seeing that what is the need that we're missing. And our job as parents and clinicians and physicians is really making that child's reality real. As Patrick was stating as well, that tracking of frequency, duration, and symptoms, asking that big ask of the parents is that you document and kind of see what times of day are these things occurring? What are our triggers? Is it a certain place? Is it a sound? Is it the opposite where we're isolated and that's our trigger? Is it a feeling? And being able to track that, and we usually request kind of that 2-week period. Gives us some good insight on the impact on daily life, which we can utilize your PCP or Patrick or myself to really guide for further assessment. And I also like to kind of highlight the connection between impulse control and sensory processing. When we are overloaded, and I mean adults as well, when we are overloaded, it is sometimes very challenging to control those impulses when we're not regulated. When we are in that emotionally heightened state, to be able to, when we hear calm down, usually it's like, no, or even as an adult hearing calm down can be that kind of cringeworthy moment. So making that connection that it isn't just them being bad, there might be a lot more going on that we don't even know about. So the next slide, I love using this acronym with parents and just kind of for education for parents and kiddos. So the calm strategy, the first one I think is the absolute most important. If you skip all the rest, number one, catch your breath. The problem is not going anywhere. Just because something happens right in that moment does not mean that if you wait 5 minutes to correct or discuss, that the problem's leaving. That shows our children that we can regulate before we act, right? So we can respond versus react, as well as being in a respectful place where they can hear us. I know that if I always kind of relate it to like a boss. I know if I had a boss that came and yelled at me when they wanted me to do something, I would be like, oh gosh, right? What did they say? Because I'd probably be a little fearful of the yelling, right? And so knowing that we are that role and that leader, and so leading by example, using a calm tone, and really practicing taking a mom timeout, taking a dad timeout, taking a caregiver timeout, whatever that is for those few minutes. The A is accept feelings. And again, for parents and children, I think it is okay to be frustrated. It is okay to want the behavior to stop. It is okay to maybe have a bout of hopelessness yourself, right? Like Kerri was sharing, when you're working from home, parenting from home, and then homeschooling from home, and then everything's at home, that is a lot. And it can feel like we're kind of stuck sometimes. And so accepting that our feelings, and also accepting our children's feelings, because just as much as we're going through this, we have built up resilience, right, with age and experience. And so really helping their framework. So we really want to avoid minimizing or invalidating And I think we do that a lot of times with good intention. Don't worry about it. You're fine. When again, we are responsible for making that reality real and that feeling real. So I think very important in the language that we use. And not to confuse you, but we don't want to reassure the worry. And so kind of an example of what reassurance would look like if we have a kiddo that has frequent fear of maybe being sick. Maybe they want their temperature taken and you do that once in the morning and then they come home and they're like, I think you need to do it again. And then we're constantly in this state of checking, right? If we have a kiddo that is afraid of going to sleep alone and are the doors locked? Are the windows locked? And it's this repetitive thing and constantly seeking that. When we reassure that, it's actually reassuring that thought process of anxiety and or just kind of those big emotions. And so something that kind of brings me to the L, labeling emotions that we utilize is, I see you're really worried right now. Is there something I can do to help you? Is there something you need to tell me about? And if we are at a point where we don't quite have that language developed yet, right, for our younger kiddos, guiding them and really, again, seeing that emotion, naming that emotion for them. How many times have you asked your child, what's wrong? I don't know. Or why'd you do that? I don't know. Most of the time, they probably really don't. For our younger kiddos, thoughts happen so quickly that they don't know why they just did what they did. And so our job is to really just kind of guide them to that. And labeling our own emotions for modeling that, but also normalizing. I know sometimes when I'm with my son driving in the car, my biggest thing is like being late. I do not like being late. And so maybe I'm in traffic and I just use it as an opportunity, teaching moment, right? Gosh, I'm really frustrated by this traffic right now. You know what? My life isn't going to change if I'm 5 minutes late. Maybe I'll take a deep breath. Because even in that education, modeling coping strategies is the number one way we get to kiddos. That is a crucial step, is really that modeling. So demonstrating those skills to assist and manage emotions, practicing with them. And I always like to highlight practicing doesn't have to look like in the moment of crisis, right? We want to practice these things when we're not mad, sad, afraid, hurt. The more we practice, the more progress that we can make with them. And I think oftentimes we're met with resistance and we see it as defiance. But I think, again, it's that educating on what's going on, getting that mind-body connection, and then demonstrating those skills. And then next slide is reviewing just some general coping strategies. Importance of diet and exercise. As Kerri said, these things have gone, right? With COVID, we maybe snacked too much. We did not get as much physical activity. Parks were even closed, right? Extracurricular activities were closed, gyms, etc. And so really that importance of diet and exercise, as they are a symptom of both depression and anxiety, really making sure that we are being mindful of that, as well as our sleep hygiene. And so just as we track those behavioral issues, tracking our sleep, being able to see, was it difficult falling asleep, staying asleep, etc. Connection with family and friends. We need people. We need people, especially after being isolated. And so I know that our world is still not quite normal, but the importance of connecting, whether it's FaceTime or a phone call or write a letter. I had my son write a letter to his grandma who lives 40 minutes away because it was something for us to do, but just connection. Journaling. Now, some kids are like, no. Some kids love it. I don't think it's right or wrong either way. I think it's just another outlet. Identifying safe adults to discuss concerns with, especially for our teen parents. That's when we really usually are like, I don't want to tell my mom and dad this. And so having, your pediatrician be that first point of contact, someone they have that comfort level with, someone that can introduce, hey, you know what, I have Patrick, I have Leah, or, they can guide you into someone that's the right fit for you, I think is really amazing. Hobbies, sports, music, drawing, whether you're in an assigned activity or that's something that you do at home. Support groups, which I'll touch on a little bit below. School supports. I know that a lot of schools are doing kind of virtual sessions. I know some are doing friendship classes and maintaining friendships and other supports, and of course, a million others. So next, we are going to discuss briefly emotional regulation skills. And so when I say emotional regulation, the ability to regulate is the noticing and of the feeling, being able to kind of monitor and then practice a controlling technique. Breathing strategies that I really love for our younger kiddos are hand tracing. So really slowly breathing in, breathing out. And then kind of for our older kiddos, I really enjoy box breathing, which is where you are inhaling for 4 seconds, holding for 4, and then breathing out like you're breathing through a straw for 6. And you practice that for about 3 to 5 minutes. And I'm sorry, I didn't say it before I read this. You don't have to worry about memorizing all of this because this will be sent to you. Progressive muscle relaxation, I love for sleep. It is the tightening and releasing of muscles and really bringing that overall relaxation feeling. Visualization is one of my favorites. You don't, and again, some of these, you don't need anything. You just need your own body, which is really helpful because it can transition anywhere. So visualization, whether it is your safe place, your favorite place, being guided to that and knowing when I'm scared, when I'm really feeling low or down, I can bring myself to that space. Grounding strategies. So a lot of times people in general, right, kids and parents, families, we are worried about stuff that we cannot change that has already happened, or something that has not happened yet and kind of fixing a future that hasn't happened, right? And so grounding strategies connect us to the moment that we're in, and that is where we have that little bit of control. And so utilizing our 5 senses, so naming things that you can see, that you can hear, that you can feel, smell, taste is really beneficial. And then affirmations and using a gentle, kind voice to yourself. I think our inner critics as parents are pretty loud, right? If maybe we yell, maybe we do something, and it's almost like when I see parents are like, I yelled at them, and I'm like, it's okay, right? That is, and to normalize that, we all make mistakes. And the most important part is the repair. We all need reminders. And I love using the analogy, like when you get in your car every day, what happens when you turn it on? Ding, 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 right? Your seatbelt. Put your seatbelt on. You know your seatbelt keeps you safe, but we still need a reminder for it. And so knowing that we may need a reminder to utilize these skills, and that is okay. So I know Patrick touched on suicide concerns, and I'm going to kind of touch on that in interventions. And I think even if we're not having a concern of self-harm or suicide, I think it's really important at a very age appropriate to open that door for dialogue. What does that look like? I think that, I know a couple of kids recently in the Canton community have committed suicide, and it has impacted a lot. And I think kids have fear of sharing thoughts or talking about it. The main thing I hear is, I think I'm going to get in trouble. And so before you have a concern, open that door, have that discussion. So if we are already at the point where we feel we are in the need of intervention or really feeling that, be direct. There's no beating around the bush. Are you thinking of doing something? If you are in immediate crisis, call 911. Never, like I always say, like don't pass go, don't collect $200. Call. It is better to be safe than sorry. If we feel that there is concern, make an appointment with your PCP. We need a professional to really determine that appropriate level of care in those next steps. And now to kind of shed light on some resources that we have, it's wonderful to have our own kind of collection of these. So using friends, like we talked about, close adults, safe adults, animals, right, like cute little doggy, support groups, and additional virtual opportunities. So some mental health apps for the littles. Breathe, Think, Do, Sesame, I love. It really connects mindfulness, and so breathing, grounding strategies, but also helps with impulse control and the stop and think. So Stop, Breathe, Think being another one that I really enjoy. And then Headspace, Calm, What's Up, the SAMHSA Suicide Safe are all wonderful apps. I believe most of them are free. They might have some of the in-app purchases, but you still are able to view some things. So for support groups, 211 is wonderful. You can go directly to their website, type in the county that you live in. You can type in the diagnoses that you are concerned with. You can type in, right now there's like a COVID relief, and just having socialization that isn't video games or other things like that. So this can be provided by, again, county, and so making it specific to your location. Ozone House is a wonderful agency in Washtenaw County, which can guide and support with LGBTQ plus specifics. And checking with schools, again, offering a lot of things. I know Washtenaw County is doing a really great job in Ann Arbor Public Schools, just because my son goes there, of offering a lot of free support groups. Crisis lines. So one of my favorites, I'm going to kind of skip a few, but I'll go back. Community Mental Health. New Oakland has a crisis stabilization line that is free 100% of the time, 24 hours, 7 days a week. This is a number that yourself or your child could call. We will provide the number as well, so don't worry about that. But they can call, they can get a coping strategy, they can give you a coping strategy, but they can also help guide if they feel, if you are in crisis and they feel like you need to go to the emergency room and be evaluated. Ozone House offers that as well. Common Ground is typically a walk-in crisis center. Due to COVID, they're doing a lot of phone calls and screenings and then having you come in. And then the National Suicide Prevention Lifeline. I think for kids in this generation, the phone weighs 5,000 pounds, especially when emotional. And so they offer a text line. You text hello to 741-741. And even if you just open that dialogue and give that information to your child, if there isn't a concern in the moment, but just to know that, you value their safety and you want them to have these resources, that alone opens the door for dialogue. And next, so finding a therapist. Recommending we utilize the back of your insurance card to call. They can help assess location, kind of what maybe age group, what you're looking for, and kind of the next step to that, I would say, would be Psychology Today. It's a website that you can put in your location, your insurance information, your concern, your age group, and the thing I love about that is that then you see a picture and you read a bio, you get to see the different modalities of treatment that people are utilizing. And I always like to kind of put the caveat of like, remember to, you know, it is okay to ask questions. It's okay to ask, what do you do? How long have you been doing this? And what are your expectations? Do you want to be able to contact them frequently, right? Whatever entering that therapeutic relationship looks like, or what you would like that to look like, to make sure that's the best fit for you. And then of course, we have our behavioral health team with IHA Pediatrics, and calling your office, whether myself or Patrick are actually physically in that office, does not matter. We can still schedule with you and be able to see all IHA patients. So to kind of wrap up a little bit, I know we shared a lot of information, and I know that it's kind of hard to be like, oh, you know, kind of going from this to that. And so to reiterate, this will be sent out to you. And if you have any follow-up questions, put them in the questions and answers. If you think of something tomorrow, you know, just please don't hesitate to contact us.
Okay. We do have some questions that have popped up in the Q&A and in the chat, so I'll go ahead and read them. And if you guys don't mind providing some answers, we will work through these. So the first question I am seeing, what kind of treatment options are there for 5-year-olds who have anxiety?
So cognitive behavioral therapy is wonderful, and you can start at 5. It just kind of looks a little bit different. I think the first and most important is education on emotions, and what are those and how do those feel in our body. I know we would do activities like drawing what it looks like in your body, drawing your worry, and really making that mind-body connection with them. And then there's also like parent interaction therapy, play therapy, a lot of different options.
And then, you know, we see 5-year-olds, and then there are a lot of different like specialty clinics throughout Washtenaw, Livingston, Wayne, Oakland counties that also have services for people as young as 4 years old. But yeah, play therapy, cognitive behavioral therapy, all those things that we mentioned.
The next question. I have a 13-year-old that I'm concerned about with a lot of the symptoms you have mentioned here tonight. When I've approached the topic of talking to someone, he's adamant he will not go, and if I force him, he states he will not talk. If he is there for a routine appointment with his doctor, can you stop in and initiate a conversation, or do we need to make a specific appointment with you?
I am so familiar with that patient. I see at least 2 or 3 of those a day, I would say. You know, and we have gotten very good. Your pediatrician will be very good at discussing things and saying, gosh, I'm really concerned about this. I have someone that I would like you to meet to help you with these feelings and with these concerns. Even if you're not worried, people that love you are worried. And so we just want to look into it a little bit more. And you're right, it might be fine, but let's take some time to kind of delve a little bit deeper into this and see what we can do. It is so handy because I have Leah at Cherry Hill Village. I can grab her really quickly to come on in and talk a little bit. And then sometimes just that initial meeting kind of breaks the walls down, breaks the barriers, and gets the kids to come back. I'm thinking of one person in particular who is your classic kind of non-communicative teenage boy who was angry at mom for being there. I think Leah's recognizing the story too. We see this often. Who had a great outcome just by coming to see me. We were able to get him hooked into services that he needed.
And with a lot of the different doctors that we work alongside, Leah and I will get creative. We will be there to say hi in a meeting. We will, you know, if they're more comfortable with that, call them just as a soft touch introduction at another point. And I know that this is also a skill of Leah. Like, you know, I worked at a crisis center, homeless shelter for 10 years. Our skill is in working with and in helping young people that are very, very, very reluctant to engage to begin to crack open and begin to engage.
Okay, what can you say when your child only responds with, I don't know, when we try to learn more about her feelings?
So yeah, that's like that is always the famous answer. And I think in the moment, it's figuring out how to regulate our feelings and emotions. So maybe that's taking deep breaths, because at that point, we don't have logic, right? So we're not processing the same. Our thoughts are moving very quickly, especially at that age. And so I think in the moment, really regulating, but then having opportunities of education. I love books and apps, and again, just kind of modeling that. And so what that could look like is, wow, having a bear looks really sad. What do you think he's thinking about? Or what do you think we can do? And making it real to them, making it not like, how do you feel, right? Because there's always kind of met with that resistance. And so whether we're reading a book at night, whether we're watching a movie, there's definitely wonderful resources that provide that education. That is the number one thing, is the education, and then guiding with language. So whatever emotion you're seeing, name it. And just because we're feeling that feeling doesn't mean that second we're going to get the root cause, right? I think sometimes that takes some uncovering and them understanding what's going on in their body. I know as an adult, sometimes I'm like, why do I feel this way, right? And I have those skills. And so really helping nurture and develop those. And knowing that sometimes it's just working on kind of treating the symptom, regulating, and then, that problem can continue in conversation to uncover.
Something that I'll use often with my patients, when I get the classic I don't know answer, I will say, oh gosh, when other kids talk to me, when they say I don't know, sometimes what they mean is, I'm really worried about this, or I'm afraid I'm going to get in trouble, or I hate it when people ask me questions. When I give them a list of choices and try to normalize it by saying other things I've experienced when speaking with teenagers, that will help them to open up a little bit more, to let them know they're not the only person who maybe doesn't know right away. But if you think about it a little bit more and have a list of options, it will start the conversation.
Okay, next question. How do you get help for your 17 and 18-year-olds when you don't really get to see or talk to the PCP anymore?
Yeah, I think I'll start, Leah, with that one. That you're right. As our children get older, we try to give them that safe space where they can come to the pediatrician's office and talk about sensitive issues and have a little bit of privacy, and know that those things won't immediately be shared with their parents. But at the same time, you still are their parent and their caregiver, especially before they turn 18. And so your pediatrician should want to include you in the visit and in the conversation. Maybe not for the whole visit. I like to give my teenagers the opportunity to talk to me alone first, and then I say, okay, I'm going to go get your caregiver and bring them back, and see if they have any additional concerns or questions. That's a great time to kind of start the conversation and then open it up further. And oftentimes you're right. The 17-year-old will say everything's fine, 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 fine. And then mom or dad will come back and say, things are not fine. This is what's happening. And then I turn and look at them and say, you said things were fine. Your mom's saying something different. What's going on here? And that will start the dialogue. The other thing I always appreciate is a phone call from parents ahead of time to say, my son or my daughter is going to come and say everything is fine, but I'm really worried, and these are the things that I am seeing. If I have a heads up and know that ahead of time, I know personally not to take that initial fine as fine. And I can delve a little deeper into it and ask a few more questions when I have your child back in the room with me privately, to hopefully get a little further into the issues.
Okay, next question says, thank you for this info. This aligns exactly to my concern about my 10-year-old. She has extreme anxiety over the last 2 weeks or so. We have had all of the medical tests rule out appendicitis, etc. calls me every day from school with my tummy hurts, and I give her a pep talk to get her through the day. She seems to be triggered by some topics at school, as well as finding herself between two best friends that are not getting along. She will not stay in her bed at night, even with calming things like lavender, sleep music, dream light, etc. She needs her mom by her side at night and needs to hear my voice during the day at school. What can I do to calm her at night as well as get her to stay strong at school without needing to call me? Sorry, this is a long story. She has self-selected talking to someone, and I am on the waiting list to see Patrick or Leah with our August appointment. I just don't know that I can wait that long.
Yeah, so it sounds like there's a school setting where a worry is about exactly what's going to happen and how somebody's going to handle a school setting, some social pressures there, sleep issues as a part of it. Very often with families, if I'm working with somebody that's 10 years old and we're leading up to the school situation, and we know that during that time there's going to be a lot of anxious feelings, and there are going to be things like topics, subjects, conflicts that provoke that kind of anxiety, is how much can be done in the car to set the scene to enter school, to be able to access calm brain thoughts, for the young person to be able to acknowledge that there are anxious feelings about the school setting, to name what are the things that make that person anxious, and then calm times and spaces to begin to argue with those kinds of thoughts, that she has in her pocket things and alternative explanations for situations in her life that she knows makes her anxious, that if she approaches with a different emotional setting, there's generally different attitude or interpretation of the kinds of things that are happening. If that's done ahead of time, and there's time in the car and if it's in-person learning, leading up to that particular setting, to reinforce what those thoughts are, reinforce those interpretations of friends, reinforce those interpretations of difficult topics, difficult classes, that would increase the likelihood of success. And that would be on top of calming strategies that she would access on her own, that the family would work to reinforce and develop, the breathing techniques that Leah mentioned, different types of relaxation techniques, mindfulness, progressive muscle relaxation, all of those things to reinforce a calm brain interpretation of things that would typically provoke anxiety. And for the sleep issues, I think we would be digging more into, okay, so are we talking about the idea of some additional challenging of anxious thoughts? Are we talking about gradual graded exposure therapy as a part of it? Like, do we need to start with 2 minutes of you being out of the room and see how much she can tolerate that, to build to 5 minutes, to build it to 8 minutes, to build it to 10 minutes? It would kind of depend on how she begins to receive those kinds of things.
Okay. Next question. After a year of not being physically in school 5 days a week, my child does not want to go back at all, has gotten used to sleeping in, working at their own pace online with virtual classes, and now says he does not understand why he has to go back if this way works. How do we renew the interest in school, and is this something you can help with if we make an appointment?
I'm not, yes and no, right? I think that with renewing interest, it's building connection and kind of uncovering again that root. So yes, we feel like this is working for you at this moment, but I like to kind of do the forward thinking for them. But what about all the things that you missed, right? Making it exciting again, because with all learning, we want to build that positive connection. And so building that, remember that one day when you had a basketball game right after school and you were so excited, or, whatever that may be. And I think, again, it's finding where is the lack of motivation stemming from? Because a lot of times it can look like, oh, I just don't want to, I want to sleep in, but really there's something more going on. And then rebuilding that connection with learning. And I know it has been a challenge for so many people because there's just been no consistency. And I think re-engaging and yeah, I think Patrick and myself, PCPs, are having these conversations so much that it is very normal to have that be a concern that we see. I can't tell you how many times on a PCP schedule, my own Patrick's school concern. And so yes, absolutely. Will he like the other way better? Maybe, but maybe kind of having some buy-in to attempt to try. Yes. So hopefully that is a helpful answer for you.
Okay, next question. It says, when treatment might be appropriate. My husband insists our 10-year-old daughter will eventually have problems with anxiety and depression because he struggles with it and sees early signs in her. He's frustrated that the system seems to be set up for kids who already have problems and not kids who are currently doing all right. How do you feel about proactive treatment before it's really necessary?
I think that kind of stems on the education piece. And I think that some, like we do here, like Kerri and Patrick were sharing about like a consult. And so maybe we go to PCP with, maybe we have a few concerns and need a little bit more guidance or education. And having one or two brief visits with us. Just because you go to one of us doesn't mean this is it can be a very brief thing. It could be a bridge the gap, or it could be a longer term therapy solution. And so having a visit that we see, where are they at with understanding? But I think it is nice to kind of, again, open that door of normalizing. Like, yes, we can talk to someone. Yes, we can get help if we need it. And now you have these safe, kind of familiar places, especially being in your pediatrician's office that you've been going to, a place you can go and talk if you need these things.
I just to reiterate what Leah said, I wholeheartedly support a proactive approach in a scenario like this. I feel like if you see a child that kind of has anxious tendencies, even if it's maybe not affecting their daily activities or their daily life yet, when I think about a 10-and-a-half-year-old girl, I will often say to parents, let's think about middle school and high school. I don't think it will get easier to manage these things during that time period. Certainly things are going to get a little bit more stressful. And so exactly like Leah was talking about, maybe you don't need long-term therapy, but one or two sessions just to introduce the idea of talking to somebody when the stress and emotional symptoms are getting to be a lot, so that they're comfortable coming to you when they're a teenager to say, do you know what, I think I need to see someone now. You can also work on, I often talk about building a toolbox of things to do when I'm starting to feel a little anxious, when I'm starting to get that tummy ache at school. What are some things that I learned that I can do to help me get through that time? Taking deep breaths, or counting to 10, or giving myself a little time out for a minute, or thinking of something that I enjoy. And just having that space with someone safe to practice those things, so that you have them when you need them.
Next question, what age do you recommend starting the talk of suicide with children, even if it is not a direct concern with that specific child?
This is where there are different appropriate levels of language to begin to talk with people about. Certainly, if I'm talking with teenagers, I worked on a crisis line for many years, talking with people about self-harm and suicide. If we're talking to teenagers, then we are very specifically naming, do you have things that you would use to harm yourself? Do you have thoughts of wanting to end your life or do something to harm yourself? Do you have a plan to implement that? How imminent is that plan? I begin to use more age-appropriate language the younger the person that gets. Like, do you ever have thoughts of wanting to bang your head against something? Do you ever have thoughts that you didn't wake up or didn't exist? Do you ever just wish that you hadn't been born? Things like that. To begin to talk about that and assess, like, is this something that this young person consistently worries about? Yeah, I don't know if that specifically answers that question, or if Leah and Kerri want to add to that, but it's more about what is the age-appropriate language. And how, is a young person going to respond when you're naming those specific things, and you have concerns about how their mood is impacting their experience of the world.
I'll just throw out one example. I stole it from Leah, actually. She's teaching me as we go here too. She had said, with the younger kids, do you ever wish you could push a button and not be here? I think that's a great way. I could see myself even using that with my 6-year-old, just to get an idea about her mental state.
Okay. The next one. My 6.5-year-old daughter has what appears to be anxiety. Many things stated tonight match her description. I'm so glad I joined this chat. My daughter's biggest thing right now is decision making. She cannot make a decision at all lately. It's like she feels like she will pick the wrong one or let someone down either way. Any pointers? Hope this makes sense. We will be seeing Dr. Ware at West Arbor this August for her well visit, and we'll be discussing these past months. However, should I take her in sooner?
Sorry, Leah.
No, go.
I would say yes, absolutely. If she's struggling with this now, Dr. Ware would love to see her to help her get some help sooner rather than later. Think about all the progress you could make between now and August if we address this issue now. And then I'll leave the specifics about how to help with decision making to Leah and Patrick.
Yes, I was definitely, to what Kerri said, and the sooner the intervention, the better. And I think decision making can be really challenging when we feel external pressures of, is this the right choice? And which can lead kind of down that rabbit hole of anxious thoughts. And so I think in CBT, there's kind of a brief line of questioning. I would say, okay, so we have two choices here. Let's work them out both. And if we chose this one, what's the worst thing that could happen, right? And will it matter in a week? Probably not, right? If we made that choice. Or if we chose this one, what's the worst likely outcome? Because then we're actually uncovering, what are they afraid of? Our worries are usually incomplete sentences. It's, I'm afraid of going to school, but we miss the why. And so if I'm having difficulties making decisions, why, right? What outcome are you afraid of? And how can we kind of minimize that to manage a little bit better? But I think having that visit with your PCP and, sooner, and just really being able to get connected can provide those strategies as well.
Okay. Looks like we got, we'll take a few more questions and then we will begin to wrap this up. Next question I have, we were just notified that we are going to be relocated to Georgia for my work. We have an only child who will be turning 10 and needless to say is less than thrilled. His attitude has changed. There's an extreme amount of sadness and anger at his mom and I because of this, and he refuses to talk with us no matter what we try, tries to tell us nothing is wrong and shuts down. What are some tactics we can use to help him open up so we can help him try to cope with this change? And then there was a follow-up. We can tell there's depression involved as well in relation to the relocation.
I wonder for, when it's, especially with families and you have histories and you live together and it's a whole complicated thing. And there's a lot of like loaded backgrounds and things. It's very complicated to, break through all of that, all the complicated stuff before getting to like a very tough topic. I would wonder about, often when it's parents like, how do I change my kid? And kids like, I don't want to change. And it becomes two people against each other. It's how can you like move alongside your child and work with him on, okay, what do we name as the problem here? And talking about it as you don't seem to want to talk to us versus I want to talk about the move. And seeing if like describing what the actual like issue is, like the problem versus like, focusing on the thing that is making people angry or trying to fix something that's angry against somebody is, all right, how do I actually align with you and decide, okay, if you don't want to talk to us, what are the reasons behind that? Is this something that we need to bring somebody else in to be able to talk about? Is this something that he can open up with a friend about or a relative or another trusted adult? Acknowledging that relationship with parents are very loaded already. And is that something that you can leverage to make more conversations and to build on as successes to begin to tackle and talk about those kinds of things at home?
One trick that I use in that scenario, I always tell parents, when kids don't want to talk to you, talk to them when they're in the car. It's very non-threatening. They're in the back seat, you're in the front seat. You have to look at the road because you're driving. They're a captive audience. They can't go anywhere. And so when you're driving to soccer practice or, to your doctor's appointment, wherever you're going, just start those conversations. And I can see myself in a scenario like that saying, gosh, this move to Georgia, I'm a little nervous about it. And to start to talk about the things that I'm concerned about or worries that I have. And then I would open that up with it. How about you? Are you concerned about anything? And just see where it gets you. You might get the I don't know, or I'm fine. But if you keep the dialogue open, you might find that one time he answers, and then you have your in, and then you just go.
Okay. For an 8-year-old virtual homeschooled child, what suggestions do you have for nail biting and redirecting? We've discussed the why and the hazards of nail and cuticle biting. We've used art, games, breathing, yoga, family walks, and behavior had stopped with the nails becoming about 80% recovered. However, with fall school returning, we would like tools or suggestions moving forward.
Can I ask the question back? Sorry, I don't know if that's weird. Fidgets, like if there's, I literally have a box, I almost grabbed them to show. There's like an AccuRing where you can kind of roll on you, which is calming. Stress balls, and all of those can be, you can discuss with the teacher prior and say, this is, this is the reasoning behind why we need this, why we need to utilize this. But there's a lot of different there's like a marble and mesh. So smaller things that are less distracting, but can keep her hands occupied and create that self-soothing.
Okay. Next question. How can you diffuse a 6-year-old while she's consumed by emotion, throwing a yelling, crying tantrum, doesn't become physical but yells? My husband and I are mindful to not yell in our household, so I'm unsure why she reacts with yelling. We currently just give her space, suggest deep breaths, and almost ignore her, and she ends up apologizing on her own. Once she's more calm, we talk about the situation. How can I stop her emotions from getting so heightened in the moment?
So I think having a little bit of information of what is going on around her, because again, when we are having difficulties with sensory processing, it makes that impulse, it really inhibits our impulse control because we're not regulated. And so when we meet a child that is really in that space, a lot of times throwing more words at them is more stimulation. And so the more they're going to react. And so that's why taking space sometimes they're able to settle. And so I think more information on what's going on around to kind of find the identified trigger or event that's triggering is helpful. And then seeing, okay, so can I remove from this external stimuli or this external force? Is this something that is unavoidable that I can't? And then how can I notice the feeling? And so I love the phrase too, if you do choose to go in the other room because you know that's helpful, I'm not leaving you, I'm leaving this situation, right? And really deferring this behavior from your child because that really decreases shame.
Yeah, and I think working with the young person on, having that better mind-body connection in all the moments leading up to a tantrum is what is important, so that they know when they are starting to get that heightened, and they know when to ask for breaks, and they know when, like, okay, I'm starting to get overloaded right now, being able to recognize that and do all that front-loading work. Because once there's a child in a tantrum, like Leah was saying, like it's the sensory overload, and it's less like, okay, so where are the off-ramps, and it's a freeway, this is a tunnel, and it's going to go through until it's done. And at that point, that's when like they have the ability to process and react and like have a calm response to the kinds of things that a parent would be bringing to them. So what are the pieces to like front load it so that they can recognize it and understand when it's going to happen ahead of time, and then gradually working over time to shorten what the tunnel is.
Looks like we have 2 more questions. Before I go to the next question, Leah, the question you just answered, the person responded, thank you. They will communicate with their school principal and teachers to use a small squishy tennis ball to redirect for nail biting and anxious feelings, and appreciates the suggestion. Okay, question. My son and I have learned a few coping mechanisms to help him during stressful times, which are every day. But I struggle to remember and maintain those mechanisms for my child. What can I do to help us both remember to do the things he needs to do to feel better?
Alarms, set alarms.
Alarms, I frequently for, depending on the age, like note cards that are literally the list of things that a young person will use that like, I know these things work for me. Or if school is a stressor, like, all right, what is the poster you can put up there while you're sitting in front of the Zoom screen? So in a moment when it's a lot, you can do that thing. But yeah, a million alarms.
I would add last May when we were in our second month of virtual school and I was home with my 4 kids, trying to see patients from home, and my husband was trying to work full-time from home. I made all 4 of my kids sit down at the kitchen table and write down a list of things that they needed to do to keep themselves healthy and things they could do when they got frustrated. And they looked at me and they said, "We hate that our mom's a pediatrician." But I made them write it, and I made them hang it on the refrigerator. And we referred back to it almost every day.
All right. We have kind of a statement and a question that will go hand in hand. I'm going to read them both together. First, it says, "It seems like there's a shortage of counselors and social workers with waiting lists at a lot of places. Is this due to the pandemic, or has it always been like this?" And this is followed by a question of, "How can I make an appointment with one of your social workers?"
I would say we could probably all agree that there was a shortage in mental health providers, but I think the pandemic has just really increased the need. We have taken our human needs and they've been stripped, right? So isolated and fear of getting sick. We've lost people. We've been in the trenches working, right? We've been at home working. So lots of heightened stress, worries, lack of motivation. So I think that has increased it. And I know that can be very, very frustrating. And I know that we have tried to kind of even do a call, like a, "Hi, I'm Leah, I've never met you before," or "I'm Patrick, I've never met you before. Let me mail you some resources. Let me mail you some things that you can do today to start while you're waiting to get into therapy," because that is an unfortunate reality. That yes, I think is really due to heightened due to COVID. And to make an appointment with one of us, all you need to, you could, if your home office isn't West Arbor, Arbor Park, Cherry Hill, that's okay. You could call your office. Anyone can schedule with us. And if there is, to be very frank, we also have a little bit of a wait, but we can try to help provide additional resources and or what to do in the meantime.
I guess I would add, as the behavioral health champion for IHA, that we recognize this need, and we're actively working to expand our program to have more help for our patients in their home office. And so, now if your home office does not have a behavioral health specialist, hopefully in the near future, we will have that available for everyone, because we definitely recognize that need.
Okay. Oh, we had one more thing pop up. I think this is a great way to end. This event was so helpful. You have no idea how helpful this was. And the fact that you did not charge me for this information, just thank you. You are so kind and talk like we are right there with you. Please do this again.
Thank you.
Just a reminder to everyone, it looks like we still have quite a few on the line. So thank you for sticking with us through the question and answers. Again, we will summarize the recording of tonight's presentation and put that together with our slides and some resources that were mentioned tonight. That will come out in an email along with a survey. If you could please just take a few minutes and complete the survey and return it, we would greatly appreciate it. And again, if you are in need of an appointment with one of our social workers, please just reach out to your pediatrician's office and we will get you set up with that. For now, we will go ahead and sign off. Thank you, Leah, Patrick, and Dr. Randall. We appreciate your time tonight.
I would just end with a little pep talk for the parents to say we're all doing a great job. We're all doing the best we can. And whatever you're doing as a parent, it's okay and it's right. Keep up the good work.
Thank you.